how are you?
Good, thanks.
Good. My name's Kangas. I'm a Doctor of Occupational Therapy student at Nova Southeastern. What would you like me to call you by today?
Barbara?
Okay, Barbara. So I just want to let you know that I have washed my hands and I've sanitized the surface. So we're going to run some tests today. We're going to do range of motion and manual muscle tests. Is that all right?
Yes.
Awesome. So for the range of motion, we're going to test your cervical flexion extension. So that's just seeing how much movement you have in your neck and if you can move it up and down. So we're going to try that out. Can you try and put your head up and then bring it back down? Wonderful. So then we're also going to be testing the manual muscle strength, or just the strength of the muscles that are your shoulder abductors. So that's your middle fibers of your deltoid and your supraspinatus. So if you could just bring your arm up, and then if you could bring it down, that's great. And then we're also going to be testing your shoulder horizontal adductors. So that's just if you could put your arm here, and then go across, and then come back. Wonderful. So that's your pectoralis major. If you have any pain or discomfort during this procedure, please let me know. Okay? All right. So we're going to start with your neck with your cervical flexion extension. So if I could just have you bring your legs around, that'd be great. And during these procedures, I might have to touch you. Is that all right?
Mm-hmm.
Okay. So the axis for flexion extension, it goes on the external auditory meatus. And then the stationary arm is going to be perpendicular to the floor, but because the shoulder's in the way, we're going to put it up. And then the movable arm is parallel to the base of the nares. All right, so if you could move your head up for me, Barbara. Thank you. All right, so using the same starting points, we're going to take the measurement now. And it looks like you have 16 degrees of flexion, which is okay. It just had to be between 0 and 45 degrees of flexion. Okay. All right, so now we're going to do extension. Mm-hmm. So we're just going to go here. Wonderful. And now if you could tilt your head down. Great. So it looks like you have 19 degrees of extension, which is great. Again, just needed to be between the 0 and 45 degrees. And now we're going to move on to the manual muscle test. So we're going to start with the shoulder abductors. Again, that's the middle fibers of the deltoid and the supraspinatus. So if I could just have you turn back around, that'd be great. And then again, just do that motion I taught you, bring it up. Wonderful. And then bring it down. This time when you bring your arm up, I'm going to apply some resistance. Is that okay?
Yes.
Awesome. So if you could bring it up. And I'm going to stabilize the shoulder, and then I'm going to apply some resistance to the distal humerus, or just the bottom of your arm. Okay. So are you ready?
I'm ready.
Awesome. So 1, 1,000, 2, 1,000, 3, 1,000. All right. Since Barbara didn't break, she's at least of a grade of a 5 because she could do the movement. She was a grade of she passed grade of a 3. If she had broke, she would have been a grade of a 4. And then if we needed to do a gravity reduced position for this, we would have Barbara lay down. And then we would just guide her through the motion, and that would be a grade of a 2. If she wasn't able to do that, for a grade of a 1, we'd look for a palpable contraction. And then if she needed to do, and then for a grade 0, we would just, we wouldn't be able to feel contraction or do the movement. All right, so now we're going to do the shoulder horizontal adductors. And if I could just have you lay on your back with your head on this side. Okay. Thank you. And again, we're just going to test out that arm movement. So you can just close your, and then go across and come back. Awesome. Since Barbara was able to do this, she's at least a grade of a 3. And now this time again, I'm going to apply some resistance. Is that all right?
Sure.
Okay, so I'm going to stabilize the contralateral shoulder, so just your opposite shoulder. And then I'm going to apply some resistance to your arm. Is that all right? Mm-hmm. Awesome. So are you ready?
Ready.
Okay, 1, 1,000, 2, 1,000, 3, 1,000. Great, so since Barbara didn't break, she is a grade of a 5. If she had broke, she would have been a grade of a 4. To do a gravity-reduced position, we'd sit Barbara up, and we just guide her through the motion for a grade of a 2. If she wasn't able to do that, for a grade of a 1, we'd feel for a palpable contraction. And then for a grade of a 0, there would be no contraction or not being able to do the movement. So if you could just sit up, Barbara. Mm-hmm. So it looks like everything's great. You're in the range of motion. You have great strength. We don't need to be really working on anything as long as you're not having any problems. Mm-hmm. Do you have any questions? No. All right, so I'm just going to sanitize the surface and wash my hands again, and then I'll see you next time, if anything.